This 7-year-old succumbed to cancer last year after we showed him in 2013 receiving palliative care. He had one of the most commonest types of child cancers, Burkitt's lymphoma. His death added to the grim statistic cancers in children in the country. Experts say 8 of every 10 children in Uganda diagnosed with cancer die. Dr. Joyce Kambugu, a paediatric oncologist at the Uganda Cancer Institute, says the figures will only get worse.
Because we don't have enough people to take care of them. There's just myself, a pediatric oncologist, and Dr. Geriga, who is a registrar training in pediatric oncology, and the numbers are overwhelming for us. So even if you want to treat these children, when you're very few, there's only so much that you can do.
That's the hard fact for the country. Dr. Joyce is the only pediatric oncologist, yet children continue to be admitted at the Cancer Institute with different types of cancer.
Burkitt's lymphoma, which I think almost everybody has seen on TV. This is the tumor of the facial jaw, facial skeleton. So usually it's the jaw or the eye that has a tumor. But we also have leukemia, quite common. Cancer of the kidney is also quite common. Kaposi sarcoma, very common in our HIV-positive population. Bone tumors.
She asserts that all these are highly curable cancers, especially in children compared to adults.
In Uganda right now, we have a scarcity of people who are specifically trained in this area.
So we want to have at the national referral hospitals, and make sure that we have these specialists who can address the children cancers.
As part of the effort, the Minister of Health, Mulago National Referral Hospital, Makerere College of Health Sciences, in partnership with Baylor College of Medicine Children's Foundation Uganda and the American Texas Children's Hospital, is introducing a pediatric oncology and hematology program in August this year to train more specialists. Dr. Ade, the ED of Baylor Uganda, sought this partnership.
We will train multidisciplinary teams because cancer requires many people. You need doctors, you need nurses, you need psychologists, you need surgeons, you need social workers. So this training will encompass everybody. Unlike when we send just one person to go and train outside.
Children in the developed world have higher cancer cure rates. Even those with sickle cell disease, about 95 to 97%, live well to adulthood compared to Ugandans.
The cancers that affect children in North America are similar to the cancers that affect children here. We believe that the place where you live should not be the major determinant of whether you survive a serious diagnosis.
Getting more specialists should level the field for Uganda and other African countries. Each year, Uganda expects 6,000 new cancer cases in children. The Cancer Institute registers just about 500 children below 15 years. Most of the cancers in children and the adults can be prevented if only people change their lifestyles, including eating healthy diets, being physically active, avoiding smoking and alcohol, and going for routine checks. Florence Nalimba, NTV.